The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon. My name is Russell Wooldridge, and as Director of Business Development for DRI International, I would like to welcome you to today's web event. Today's presentation is The State of Business Continuity in Healthcare, and as always, our goal is to provide insight into the business continuity concerns of an important economic sector, in this case, healthcare, and how our new certifications and training program relate to professionals in that arena. The next hour has been designed to fill you in on everything you need to know about this exciting field and how to get the most out of it through certification. The significance of the field from insurance to patient care is well documented and understood. It's a large sector of the economy and as such has both unique and universally recognized recovery issues. During today's session, we'll be hearing from speakers who are on the cutting edge of business continuity planning in IT, insurance, and the world of hospitals and medical centers. I'm sure you already have many questions in mind for our speakers, and we welcome all of them. Please use the question box at the bottom of your control panel on the right-hand side of your screen. Simply type in your question at any time during the presentation, and we will answer as many of them as possible during the Q&A portion of this webinar. Before we get on to our subject matter experts, I'd like to take a moment and provide some background and the rationale for DRI International's decision of taking the step to certify professionals in this environment. The World Health Organization, the WHO, estimates that 16% of the gross domestic product of the United States is healthcare in one form or another. The National Center for Healthcare Statistics is a department of the U.S. federal agency, the Centers for Disease Control and Prevention, and is tasked with gathering a variety of statistics and data in this field. According to the National Center for Health Statistics, in 2005, the people of the United States spent in excess of $2 trillion on healthcare expenditures. Visualize a 2 with 9 zeros following. More than $7,129 per capita is spent on healthcare in the United States. Of each dollar spent, according to a 2009 Kaiser Permanente study, 65% goes to hospital, clinical, and nursing home care. 16% spent on drugs, home care, and other related retail products in the United States alone. These organizations and others project a growth rate of near 7% annually for the near future in healthcare. It has become a cliche to say that healthcare is big business, but it's better to think of that as an axiom. In the field of business resiliency, it's also well documented that the professionals and the institutes they serve are among the most heavily and thoroughly regulated in industry. Many of these regulations have the benefit of being well established and have passed the rigors of time and application. The Healthcare Insurance Portability Act of 1996, or HIPAA, in place for more than 16 years, is often the standard by which all regulation on electronic records keeping and continuity plans is judged. Even before that, there was the Joint Commission on Accreditation of Hospitals in 1951, renamed several times but referred to most broadly as the Joint Commission, or now merely by the acronym JCAHO. Originally used by hospitals and medical centers to validate Medicare requirements, JCAHO is used to evaluate a whole host of requirements from quality assessment in patient care to the safety of the medical workplace. Beyond HIPAA and JCAHO, there are a host of regulations, conflicting standards, local rules that resiliency professionals must understand and apply correctly. As an ANSI certified standards developing organization, DRI International is first and foremost the certifying body maintaining the standard for resiliency professionals globally. Given the magnitude of any impact in a field as economically important as healthcare, resiliency professionals face complex and demanding issues. To address the needs of these professionals, DRI International has developed the Certified Healthcare Provider Continuity Professional and Associate Healthcare Provider Continuity Professional certifications. The CHCP and the AHCP are the specialized recognition that resiliency professionals have needed to help them stand out in this competitive marketplace. As always, DRI gathered leading industry specialists, people who actively work in and understand the complex environment of this field, and put together the professional requirements, processes, training regime, and unique qualifying exam necessary to begin granting recognition to resiliency professionals in healthcare. The CHCP and this entire program is about the people that serve this most significant of industries. And now let's hear from our panel of experts on where BCM is in the healthcare environment. We have 5 senior professionals on the panel, all of whom are currently working in the healthcare space. We'll be hearing from Andre Cabaero of Horizon Blue, McKesson's Hector Fulgencio, Paul Katzer of Pfizer, and Bob Watkins, who works healthcare for CSC. But first, I'd like to introduce Angela Devlin. Angela is the managing partner of Wakefield, Brunswick, Incorporated, a healthcare management consulting firm. She's also the president and co-founder of the Mahila Partnership. She is an advisor to national and international healthcare and nonprofit organizations and is currently working in the U.S., Nepal, India, Costa Rica, and Haiti, leading healthcare, economic development, and disaster risk reduction initiatives in all those countries. Angela, what can you tell us about healthcare business continuity from your perspective?
Thanks so much, Russell, for inviting me to be a part of today's webinar. In my experience over the last 20 years in working with hospitals and emergency management and business continuity, I think this is a very timely topic. As we all know, hospitals need to remain operational, particularly when they're needed most, and we're seeing that in disasters that have occurred most recently. You know, our communities look to us for the care that they need more than ever during times like that. So our role is to continue to provide health care, particularly health care that remains safe at all times, and that does include in times of crises. Many hospitals and large health systems that I'm currently working with are actually increasing their focus on business continuity planning and are making it as an area of priority, and we're seeing this in all parts of the country. So I think that this is a great opportunity for hospitals to round out and improve their overall healthcare preparedness. The way that I see business continuity achieving this is it really does go beyond meeting the needs of preparedness beyond the traditional mass casualty incident planning. It helps in working with hospitals and responding to and remediating interruptions that might occur for other reasons, and those interruptions that I'm talking about are like interruptions to their clinical and business processes, not just sort of again your patient-focused mass casualty or other disaster event. So when we look at business continuity, what we're having the hospitals we're working with look at is how do we take aspects of traditional business continuity planning to reinforce and augment existing emergency management initiatives that they already have underway. And this really allows for a more holistic approach to managing risk to the organization as well as to the patients and staff. So this is how we're seeing business continuity occur in healthcare. And some of the considerations that we think are really driving attention to business continuity in healthcare are, there's 3 or 4 things. There's the COOP requirements that are being handed down from state public health departments. Continuity of operations planning, known as COOP, and defined by others as business continuity, is that the public health agencies are now being asked to do this, so they're of course asking the hospitals that they're working with to take on those same activities. There's also the rapid increase that we've seen over the last 2 years in the adoption of electronic health records, and that's occurring in both hospitals and primary care settings at a significantly accelerated rate. There's a lot of those in emergency management that are identifying gaps with their preparedness as a result of experiencing actual events themselves or from lessons learned that have been shared by hospitals that have experienced interruptions or even catastrophic events that has really allowed for some lessons learned from a business continuity perspective. And then, and more recently, we're finding that hospitals actually are hearing from their board members who happen to lead organizations in other industries where business continuity is more widely practiced, that they're asking hospitals now where they're serving on the board for the business continuity plans within those hospital and healthcare delivery organizations. The other thing that I wanted to really focus on is, in principle, is just a philosophy, and that is that I believe that business continuity in healthcare is essential. You know, we look to hospitals, just as we look to schools, as having a symbolic value for our communities. And hospitals are occupied 24 hours a day, 7 days a week. And they are housing and are occupied by our most vulnerable populations and individuals who need that highest level of support and assistance, particularly when you're talking about your high acuity patients in your intensive care units and emergency departments and so forth. So in addition to this population of patients that we're committed to serving, then you have this high density of expensive equipment, and you have the role of hospitals in their communities where in many cases the resiliency of the hospital can be tied to the resiliency of the community, that we really believe that hospitals need to invest in remaining functional, particularly in a post-disaster situation. To have them remain functional, they can be a part of helping stimulate the economic recovery of the community as a whole. I'd like to speak to the certification, the education and certification that DRI is putting forth, and I'm enthusiastic about being a part of that effort, and I really just wanted to be sure to point out a few things that I thought that the education and certification that DRI is offering addresses. One is that current emergency management education and training that is out there doesn't traditionally address business continuity. This is particularly within any of the healthcare emergency management curriculum. So this, I think, will help round that out for individuals, emergency managers, disaster recovery planners, business continuity planners within healthcare, but also other administrators that might be interested in participating in a education opportunity with this that really helps understand this. Medical practitioners and professionals as well, that many of them serve on system-wide emergency management or business continuity task forces. So I just think that this really now provides a venue for folks to get that education that previously didn't exist. The other thing I like about it is it's going to allow for a standardized way for approaching business continuity in hospitals. Right now, within healthcare, this is a new discipline. There are professionals out there that understand business continuity in healthcare, but it's mainly drawn from experience and not, again, because that training's been available. So this allows for new people to come into the market or other professionals that have been doing this from a practical standpoint and now being able to merge the practical and theory a little bit in a consistent and standardized way. And then last but not least, which is the part that I think is really essential, again, particularly as a new discipline emerges, is given that we have a lot of folks with great knowledge out there, this will allow for that peer-based information sharing and learning. It provides a venue for professionals to come together and share that information. I think that being able to share that information in a way that it can also be delivered through the curriculum so that those that are participating in the training really gain from those lessons learned. And I think that helps our hospitals and in turn helps our communities as well, of course, the professionals that serve in that role. So thank you for giving me again the opportunity to at least weigh in on the topic and provide my own thoughts. I appreciate it. Thank you.
Thank you, Angela. Insurance companies must be able to provide steady and consistent client support at all levels of the healthcare supply chain. To speak to that special circumstance is Andre Cabaero. Andre joined Horizon Blue Cross Blue Shield of New Jersey as a business continuity coordinator for Horizon Blue. He was given the task of reviving its existing plans and enhancing them to reflect the current and robust business continuity program philosophy. He accomplished this through identifying the company's critical functions and their resource requirements to ensure their preparedness to recover critical business operations in case of a business disruption. This led to his promotion to business continuity manager with enterprise-wide responsibilities. Go ahead, Andre.
Thank you. I am going to be speaking specifically about Horizon Blue Cross and Blue Shield of New Jersey's Business Continuity Management Program. Our main goal, obviously, is for to be there for our members and our providers in order to continue providing them with the services of Horizon's insurance. There are a few certifications and actual regulations and mandates that surround Horizon's business. For example, HIPAA, Department of Banking and Insurance, DOBI, URAC accreditation, CMS for Medicaid and Medicare, and also, just as importantly, the Blue Cross and Blue Shield Association has a certification where they require their licensing companies to meet certain standards every year in order to continue carrying the Blue Cross and Blue Shield Association license. Horizon is an independent company from the association. However, we have their licensing and continue to try and meet their requirements yearly. So the BCM program, part of its goal is also to ensure that we continue to maintain that Blue Cross and Blue Shield Association licensing. Our mission critical processes, again, surrounding our members and providers, is to continue to provide customer service, number one, in order to be there for our members and providers, whether it's, for authorizations or paying claims. We ensure that, or we try to ensure with our BCM program, that after a disaster, we are able to at least continue communicating with our customers, our members, and our providers in any event. So customer service is our first mission critical processes. It's processing and claims payments piece, and billing and enrollment. Now, to ensure customer service and claims processing continues after a disaster, there are a few steps that the BCM program has put in place for Horizon, whether it's a pandemic or any type of a disaster, that we are there for our members and our providers. And examples of that would be our outsourcing program, where we have in different parts of the world, not just nationally in the U.S., but also in countries like India and the Philippines, where we have call centers and claims processing services so that we can continue to provide those services for our members in an event of a disaster. For our other operational recovery strategies, Horizon does maintain an RTO of less than 72 hours. Within the past couple of years, we've been able to successfully test our systems from an IT perspective and bring our mission-critical systems and applications back up and running within a 48-hour or less time frame. From a recovery point objective standpoint, our data is very critical, including not just our members' data, but also from an email standpoint. Our database is synced to a synchronous replication, where from 0 to 15 minutes, we are able to replicate our data from one data center, our primary data center, to our secondary data center. From a pandemic perspective, we have also worked in the past with the New Jersey Hospital Association and the New Jersey Health Plans Association to ensure that we are able to meet, again, our members and our providers' requirements and continue to process and pay our claims, and also to be there from a customer service standpoint as well. We ensure that we're able to conduct that, once again, through our outsourcing capabilities, and we have also implemented a work-from-home capability. Although we are only located in New Jersey, we do have multiple locations across the state. And to add to that redundancy, we do have mission-critical employees who have the capability to work from home in the event of a disaster like a pandemic. An example of our resilience, the resiliency of our plan, as we all know, or as most of us know, Hurricane Irene did quite a damage up and down the East Coast, and New Jersey was one of the states that was heavily impacted by that disaster. And we at Horizon ensure that we were prepared for that hurricane, where once again manning our data centers 24 hours throughout that weekend, and also unprecedentedly set for our strategies, we were able to work out as well through the Blue Cross and Blue Shield Association and our connections with the other plans, that we were able to set up a VPN connection, or a backup VPN connection, in case both our data centers did go down. We are able to continue to have our outsourcers and those employees that are working from home VPN through one of the other plans, specifically our Michigan Blue Cross and Blue Shield plan, go through their VPN network in order to connect to our claims processing systems with the vendor NASCO. That was actually a big help because one of our outsourcers that was impacted due to Hurricane Irene, where they were not able to come in through their primary circuit, although we were able to get them back up through our secondary circuit, in the case that we weren't able to do that, we would have been able to at least connect them to our claims processing systems where they have the information they needed in order to continue servicing our members. Those are part of the strategies, recovery strategies that we have at Horizon for our business continuity management program, again, to ensure that we are there for our members and our providers and continue to provide them with customer service and, just as importantly, our claims processing and our claims payments. If there are any questions, please feel free to reach out to me, and I'll try to answer them the best I can. Thank you again.
I've known our next speaker for quite some time, and he was all too happy to take the invitation to come and speak to us today. Hector Fulgencio has been in the information systems industry for over 32 years and has over 25 years of managerial and technical experience in this field. He's been with the American President's Line, Delta Dental, Pacific Gas and Electric, National Cash Register, and Kaiser Permanente. But let's not drop names. Hector is the Manager Solutions Architecture for McKesson Corporation's IT Service Continuity Office. As the architect with the McKesson Corporation, he provides disaster recovery and business continuity consultation and oversees the pharma disaster recovery IT environment. He is currently managing the pharma disaster recovery equipment refresh, which includes virtualization and consolidation. Hector is an MBCP. What can you tell us, Hector, about this subject?
This is the state of business continuity and disaster recovery in healthcare and to McKesson Corporation. McKesson Corporation identified 5 key initiatives. The first initiative was enable the business of healthcare to run better so patients can get healthier. McKesson is the nation's largest healthcare services and information technology company that's focused on helping our customers innovate and build stronger through improved operations, access to the most advanced clinical data, and better connectivity. We work with customers across the entire industry, from hospitals, payers, and physician offices to pharmacies and pharmaceutical companies, to build stronger healthcare organizations that deliver better care to millions of patients in every setting. Therefore, business continuity is critical in ensuring that these services are continued in the event of any disaster impacting any of the company's facilities. Key initiative number 2 is critical role in helping the organizations in healthcare achieve better health. This initiative helps hospitals keep their doors open through better financial and supply chain management. We develop software that helps pharmacies to provide the right prescription every time. Very critical. Makes physicians' practices more efficient so patients receive a higher level of care than ever before, making a difference for better business, for better health, patient health, and all for better health itself. Key initiative number 3 is health organizations can leverage technologies and services to promote better health in business, in care delivery, and in connecting all members of the healthcare delivery network. Technology helps promote, automate processes, and drive efficiencies into operations. At the same time, it helps conserve resources, improve turnaround time, and provide actionable business intelligence and reduces errors. When a hospital automates the business and operational ends of care, it frees its human resources to provide better care to its customers, the patient and their families. Key initiative number 4 is the central reality of American healthcare is that the institutions that deliver it, from one-person medical practices to major urban hospitals, are all businesses. There are nearly 6,000 hospitals, 670,000 physicians, 2.9 million nurses, 56,000 pharmacies, and 1,200 life and health insurance companies that exist. Every one of them faces the same kinds of fiscal, operational, and competitive concerns as any other business. And like other businesses, they serve their customers, just like us, best when they themselves are thriving. The last initiative, number 5, is better connectivity for better health. If you consider the number of providers and businesses involved in even routine treatments, you can see that the clinical needs to improve information flow, automate transactions, and become smarter and more efficient at every step. Better connectivity streamlines and enhances how healthcare operates. It reduces waste, improves safety, and enables access to the best treatment. Most importantly, it frees physicians, nurses, pharmacists, and technicians from chasing charts and filling out claims to focus on what really matters, the needs of each patient. Thank you, Russell. I appreciate your time.
Thank you, Hector. No discussion of healthcare would be complete without hearing from a representative from the pharmaceutical industry. One of the leading multinational corporations in that industry has a representative with us today. Before joining Pfizer, Paul Katzer served as a natural resource scientist for the New York City Department of Parks and Recreation and a director at the New York City OEM. Paul is currently the senior manager for Pfizer's worldwide BCM group. He supports the implementation of Pfizer's BCM program, delivering training and support globally. Previously, Paul was responsible for business continuity at Pfizer's New York headquarters. In this capacity, Paul led the successful recovery of critical business operations disrupted by the July 2007 steam pipe explosion in Midtown Manhattan. Paul, what is business continuity like for a large transnational manufacturer?
Thank you. Continuity in pharmaceutical manufacturing and distribution is essential to public health, as well as being a fiduciary responsibility for the company. At Pfizer, we identify critical products not only based on their financial importance to the company, but also by whether they are identified by the World Health Organization as an essential medicine. Ensuring the continued availability of these medicines is an important component of Pfizer's BCM program. Business continuity plays an important role in managing very diverse risks across our business. Our business has distinct operating environments: manufacturing, logistics facilities, and research and development facilities, in addition to typical office or data center operations that you'd find in most commercial organizations. Each of these facilities have unique risk profiles, and often research and manufacturing processes are spread across multiple sites and sometimes in different countries. We operate in about 100 countries, some of which have more resilient infrastructure than others. For example, in developed countries, we will have more robust utility, IT, and telecommunications, as well as public safety response infrastructure. Whereas in emerging markets, our operations may have to take on greater responsibility for managing risks related to their infrastructure disruptions. Additionally, we have complex supply chains for global manufacture and distribution of our products. Pfizer uses an all-hazards approach to managing business continuity risks and disruptions. The business actively manages risks and routine disruptions across research, manufacturing, supply chain operations as part of their normal business processes, whether they think of this as business continuity or business as usual. For incidents and disruptions above and beyond those encountered in daily operations, business continuity preparedness provides a framework for mitigating the consequences of a disruption. Consequence-based planning ensures plans are flexible and adaptable regardless of the actual cause of the disruption, yet provides sufficient detail for resource and planning and capability requirements. Business continuity is just one part of Pfizer's overall business resilience approach. Business continuity works together with other risk management disciplines: emergency response, crisis management, and IT disaster recovery. By using a coordinated approach to resilience, we ensure that our business operations are preparing holistically for diverse risks and have effective mitigation and response strategies and capabilities in place.
Thank you, Paul. Our final panelist is Bob Watkins of Computer Science Corporation. He is CSC's EMEA Regional Manager. Like our other panelists, he has a varied and well-focused career working with J.P. Morgan and Minette Ion Insurance, as well as Irving Trust and the Bank of New York. As a member of the EMEA Business Continuity Group, he makes significant contributions to the development, management, and implementation of a number of high-value business continuity and disaster recovery projects across the broad spectrum of industry types that CSC serves, including financial, retail, government, and general industry. For the last 4 years, he's been defining and laying the foundation for the successful BCM programs in support of CSC's clients in the healthcare sector. Bob is calling in from the UK, and we have a bit of static on the telephone line, so please be patient. Bob?
Hello, everyone, and thank you, Russell, for that and the opportunity to come along and speak to everybody today around our thoughts and experiences here in CSC on the health sector. There are 5 particular areas that I want to try and share with everybody today, and that is really the following, really. It's what drives business continuity management in the health sector, trying to understand the business and understand what that means to them. Secondly, the real area of confidentiality and management and security of data. And the data is, as you can appreciate, contains a lot of personal information about individuals and the way in which we actually manage that data and how we actually provide that data in the service continuity arena. Just one solution, strategically, can we recover and have a single capability that fits all, and what level of diversity we might need to have in place to ensure that we can deliver a risk-managed solution. Compliance and assurance is required. Compliance and assurance is an area which is very significant to the health sector that we've identified, in as much as that there is lots and lots of areas here that has so many different intrinsic risks that can impact and affect the ability to deliver services in the service in the health centre. And finally, what level of business continuity management and planning, to what level of detail is required, and how we've actually moved that forward in terms of meeting that level of demand and mitigating risk. So firstly, coming back to what drives business continuity management, well, it's really around clinical safety and effective risk management and mitigation. So what does that mean? In every aspect of the service, the focus is delivery on excellence in all aspects of patient care, and actually mitigating and managing any risks that are associated with meeting that level of excellence is something that's in the foremost of all the health sector risk managers' minds and the CEOs. The increasing dependency on IT services to aid and support clinical diagnosis, decisions, and the ability to provide effective treatment drives a holistic approach to service continuity. It's essential that that dependency has a recovery capability that is second to none, because obviously the ultimate risk associated with this is all around the individual, the quality of care, and hopefully the ongoing life of an individual. So, the ultimate risk here, rather than being a commodity-based organisation, is potentially the loss of someone's life. So that is really a driving influence and a driving focus for continuity management in the health sector. Moving on, in terms of security, confidentiality and availability of patient data, this is paramount within the organisation. The accurate and concise management of data between linking demographic details of an individual to their clinical history is so important in terms of ensuring that you can have effective clinical treatment. And this is one of the things that is actually driving the need for IT service continuity. and the need for an effective design that enables you to have an ability to deliver guaranteed zero data loss. Here in CSE, based on those two principles of one, trying to manage data, and second, to deliver to patient care or the excellence of patient care, we've put together some designed solutions that look at managing data and keeping data within multiple data centers, but within their own geographical and logical domain. So we keep and sustain that level of security and confidentiality, but also providing a risk-based balance of data being replicated between data centers. And this has proven to be a very successful process going forward. There's one continuity solution and or capability and strategy fit all. I think the answer really is no. Due to the diversity of the clinical and patient care that each healthcare service may need, single recovery strategies and solutions just do not work. There has to be some level of ability to provide customization and variation, even down to the level of individual solutions, which can be recovered and recovered independently, because any interruption to service could have consequential and also ultimately fatal consequences. So obviously, providing continuity solution and a capability that has diversity and the ability to customize it is essential, and one that the business is really looking forward to moving into in that area. Business continuity management, compliance and assurance. Another area, because of the level of sensitivity, because of the exposure and the risks that providing healthcare service brings, the level of assurance that the CIOs, the risk managers, the senior clinical practitioners and consultants are looking for throughout the development and the building of security solutions is so high that it's essential that you put in place a solution that has the ability and the strategic strategy for putting together a very comprehensive and stringent program of testing throughout the life cycle of the whole service that you're supporting. The full engagement and participation and transparency with the clinical representatives is something that's so important to make sure that they have full visibility of what you do and have a level of confidence in your solution. And having had that and developed that, we've now actually started to move towards providing accreditation to various business continuity standards, such as BS 25999. And this has proved invaluable, not in terms of improving our service capability, but certainly invaluable in building that level of confidence with the risk managers and building that level of compliance and collaboration, which is a significant element in terms of delivering the service, and one that helps to build upon in terms of sustaining and retaining that business with the health sector. And finally, I think we've passed the last point I wanted to talk through was around business continuity management planning. As an IT outsourcing company, I guess it's very easy to say that you can focus on just put the IT service continuity only. This simply cannot be the case. I mean, the level of risk, the complexity of the service, and the number of external agencies and other providers involved necessitates a holistic but very detailed set of plans which will interact with all of the interested parties and stakeholders. This has included a wide spectrum of plans in our portfolio, which covers a number of different disciplines, such as emergency response, crisis management, business recovery action plans, and service recovery action plans. We've had the need to develop service action plans, which is slightly different to the norm, where we're focused on individual services and how we recover individual services to a level of detail that probably is far greater than we would normally have to do for other industry types. So big providing that level of detail and getting down to that level of detail is fundamentally key to providing a quality IT solution and a good basis for business continuity management and retaining the confidence and the assurance with the CEOs and the CIOs based in the health sector business groups. So in summary, I guess, there are two key areas. One is what we found is the desire and the need to mitigate risk, to meet patient care and the excellence of providing healthcare solutions, and the need to ensure that and demonstrate the very clear desire to ensure that confidentiality, continuity and high availability of data, and transparency in terms of everything you do is key and fundamental with the health sector groups. So I hope you found that interesting and useful, and if there are any questions, I'm sure that they could be picked up in the quick Q&A session at the end. So I'll hand you back to Russell, and thank you very much.
Thank you, Bob. It was well worth the concentration. Finally today, we have some of my DRI International colleagues on the webinar to discuss our latest certification program. Becoming certified as a Certified Healthcare Provider Business Continuity Professional, CHCP, reflects the deep personal commitment and sense of accountability that in turn inspires credibility and confidence in your professional knowledge. Certification demonstrates your professionalism as well as your dedication to professional development and your desire to contribute to the high standards held by healthcare industry continuity professionals. Holding a healthcare provider certification will help you meet the challenge in today's healthcare system while pursuing innovative solutions for tomorrow. As mentioned earlier, the CHCP and the AHCP certification will enhance your ability to incorporate Joint Commission, HIPAA, HITECH, and EMR requirements into your business continuity plans. The associated prep course will discuss the deployment of the Hospital Incident Command System and the integration of the program into the continuity of emergency medical operations and hospital administration business continuity requirements. Kelly Okolita, DRI Director of Education, is here to tell us a little bit more about the course of training. And Tracy O'Neill is on the line in her capacity as Director of Certification for DRI to answer any questions we have regarding certification requirements. Kelly, talk a little bit about the course.
All right, thank you, Russell. Just a little bit about why we decided that having a healthcare course was particularly important in this day and age. We were approached by several subject matter experts in the healthcare industry to think about this particular type of course or certification to address the issues that are unique to the healthcare provider industry. This is really around the providers. It's not, certainly insurance professionals and et cetera in the healthcare market could benefit from this class, but it's really about the providers. The providers, when we're talking about business continuity in the healthcare environment, where we're talking about hospitals and et cetera, we're not just talking about dollars and cents as we would be in the financial services industry. We're really talking about people's lives. The success of a business continuity program within the healthcare environment could mean the difference between people living and people dying. So it's a very different environment, and we felt it was important to recognize the different regulations that apply within the healthcare industry, as well as the unique needs of the healthcare industry. So we reached out to some subject matter experts about the actual course content and what should be included in it. And we, as Director of Education, I kind of provided the framework from which to deliver the materials, but really depended upon the subject matter experts in the healthcare field to help us build the content, to talk about what's important in this industry, talk about what's different about providing these services within the healthcare market, and to talk about very specific requirements that have to be met in order to be successful in the healthcare environment.
Kelly, Tracy, it looks like we have a few questions. Let's see if we can provide some answers in the time we have left. Tracy, the first question is actually for you, and that comes from Paul. He's a certified professional and wants to know what would be required of a DRI CBCP who's been working in healthcare for over 6 years to achieve the new certification from DRI International.
Okay, to qualify for this certification, you must first pass the healthcare examination, which is different from our certified professional qualifying examination. For those holding a current CBCP or MBCP certification with DRI International, a portion of the experience section of the application will be waived. Our Certified Healthcare Provider Continuity Professional certification is for those individuals who have demonstrated knowledge and working experience in the healthcare business continuity planning and should have more than 2 years experience.
So one other question along that line, Tracy, comes from a fellow named William, and he wants to know, is a healthcare background absolutely essential for these certifications, or can the non-healthcare person get involved in this program?
To answer that, the answer would be no. If you do not have enough experience in the healthcare, you would want to apply for our Associate Healthcare Provider Continuity Professional certification. It is designed for those who are new to the industry. It supports an entry-level proficiency with some knowledge in the healthcare continuity planning. It is suitable for those who have not yet gained significant experience in the business continuity.
Okay, thank you, Tracy.
Thank you, Russell.
Thank you for helping with these questions, ladies. I think we answered most of them. Ladies and gentlemen, if you still have questions or need information that we didn't cover or want to schedule training for your team or your department at your medical facility, please give DRI a call at 866-542-3744. A recording of this and all our webinars is posted on our website, which is www.drii.org. Speaking of our website, I also encourage you to visit driconference.org for information regarding DRI 2012, DRI International's exciting new conference and exhibition in New Orleans, Louisiana, May 20th through the 22nd, 2012. Among the speakers you'll want to catch is James Baturis of the Yale New Haven Health System. His presentation will reveal the results of the Yale New Haven CEP-DR study on healthcare facilities' ability to serve critical care patients during and after a crisis. And now I want to thank everyone who participated in today's session. It was insightful and illuminating. To our panelists, you have helped shed light on the issues and best practice in healthcare resiliency. We appreciate your input and your experience. And thank you, the participants, for taking time out of your schedules to learn more about healthcare continuity and these new DRI programs. If you are a certified professional, this webinar is covered under the CEAP schedule. I'm Russell Wooldridge, and this webinar has been a production of DRI International 2012, all rights reserved. Thank you for your attention.